So here we're going to be talking about the new Morpheus8 body tip, which is a larger body tip for faster, deeper body treatments, and the Morpheus8 burst technology, which is radiofrequency vulcanization technology. So the new body tip is a deeper fractional technology than the tips that we previously had. Instead of the regular 24 needles, we now have 40 thin gold coated needles, which are 300 micron diameter. And we can penetrate into the tissue from 2 to 5 millimeters or up to 7 millimeters on the body type machines. We also get an additional millimeter of heat from the depth that we go to. We have coated pins with a 0.5 mil conductive tip. So as those of you already using the machine will be familiar with, the heat is just isolated to the very distal tip, meaning we've got little thermal damage to the epidermis. And with the sharpness of the needle, this in turn means that we get less downtime. You have a larger lattice panel, so we have a bigger surface area with the body tip. They're a disposable tip as always, so they're single use only. But being bigger and having that denser treatment of the 40 needles, they're designed for larger body areas in particular, such as the abdomen, buttocks, and thighs. And we're working with the traditional Morpheus principles. So it's the subdermal adipose remodeling device, or the SAD technology. So the energy is applied between the tip of the needle and the external electrode, which we place onto the skin surface. So we're sparing the epidermis here, reducing our downtime and our risks, but we're getting ablation around the tip of the needle and then our fat coagulation zone, and so volumetric bulk heating. We get a large volume of tissue affected because we have a larger zone, and now we have more needles as well, so we're creating more heat and more bulk heating within the tissue. And as always, the needle is creating a mechanical damage, so that in turn will create our wound healing response and stimulate new collagen and elastin for the dermis as well. And then we're going to look at our new burst technology. So burst technology is based on something called vulcanization technology. And vulcanization is the process of treating natural rubber with heat and sulfur to cross-link long chain molecules and produce improved physical properties, which increases the elasticity, the stability, and the tensile strength. It was discovered by Charles Goodyear, so people might know it from tires, and originally used purely for natural rubber, but it's then been extended out into other applications to change physical characteristics. And so the fibroceptal radiofrequency vulcanization here produces cross-linking of the collagen molecules at various depths, and that leads to the strengthening and the skin adipose matrix of the area. So it's a unique proprietary radiofrequency technology for InMode, and we're creating fibroceptal network bracing. So we're supporting that fibroceptal network system, and that results then in a strengthening and an overall skin adipose scaffold effect. We're forming cross links between the long collagen fiber molecules in a layered pre-selective depth range. We can target that at different depths. We'll look into that. And then that RF thermal zone created isn't limited just to the reticular dermis, so it can penetrate deeper into the fibroceptal network and lead to increased strength and support of the entire dermis and the adipose interface. So it's a three-step vulcanization process. We're looking to charge, mold, and weave. And so step one, charge, means that we have a powerful RF concentration of energy that bursts into the skin, delivers deep into the tissue, helping to cause reorientation of the collagen fibers. This in turn produces step two, so we start to mold, and that energy dissipation leads to block heating, resulting in the collagen remodeling and strengthening, which reinforces the fibroceptal network. And then we have the third step, which is to weave. So that energy from the RF is delivered into the dermal level, causing pulling and sinking of the fibers into a weave and supporting fully that area. We have customizable depth settings, so depending on your device, on the body type machines, we can set it at 7 mil. This will fire the needle at 7, 5, and 3 mil. Or you can set it to 6 mil, which will fire at 6, 4, and 2 mil. On the aesthetic devices, such as the Optimus and Tritons, we can set it to 5 mil on the screen, which will fire the needle and the energy at 5 and 3 mil. or at 4 mil for more superficial areas, which will fire at 4 and 2 mil. The benefits of the 5 mil restriction mean that we're avoiding hitting larger vessels that could cause quite significant bruising. We're reducing the downtime because of that reason, and we're also avoiding hitting any additional nerves, which could potentially cause some transient loss of sensation. We're also, remember, getting an additional millimeter of heat. So even with the needle at 5 mil, we're still getting heat to 6 mil, and same with 4 mil penetration, we're getting heat down to 5 mil. And this just shows us where the needles are firing. So on a 7 mil setting, they'll go down to 7 mil, fire first at 7, retract to 5 mil, fire at 5, and retract to 3 mil and fire there before leaving the skin. And then similarly with the 6 mil, they'll fire at 6, then 4, then 2 mil. And then for the 5 mil settings, we've got the 2 shots. So we will fire at 5 mil, the needles retract to 3 and fire at 3. Or for a less thick tissue, we can fire at 4 mil, reduce to 2 mil and fire there. So it's a bulk heating effect across the area, and we're really focusing and concentrating the energy in that one shot. This gives you a little example of the treatment. And here we have an example where we can actually see the needles firing out into the skin. This has obviously been slowed down. This happens in milliseconds naturally in the skin, so it's a very quick treatment, but they've slowed it down here so that we can see the response within the tissue. Okay, and so some treatment considerations during the body and burst treatment. So similarly to the face, we're going to need at least a topical anaesthetic on for around about 30 to 60 minutes, depending on the manufacturer's recommendation and experience. And then that needs to be removed thoroughly before we begin the treatment. Alternative and additional anaesthetic means can be used if you have appropriate trained personnel to do those. And we clean and sterilise the treatment area before treatment, make sure that the topical anaesthetic is completely removed and the area is sterile, and then we attach a new body tip. And as we've said, tips are single use only. You want to ensure a really firm contact of the whole tip with the tissue, so all 4 corners must be in really good contact and firm pressure applied. Sometimes on soft tissue areas, particularly stretching the area can be necessary and can be helpful for getting that good contact. But occasionally, particularly on an area, maybe say like an abdomen, the patient can help you assist with this. And then, as always, we want a good 50% overlap of the pulses. This helps us get a good even treatment of the area, not leaving any gaps that we would then need to go back and fill in. And if you're performing more than one pass, then it's good to do alternate directions. So if you've gone from the left to the right of the abdomen for the initial pass, maybe you would go from the top to bottom for the second pass. And again, this just helps to fill in any little gaps that you may have possibly missed on that first pass. You'll notice from the QRGs, which we will send out for you, that there are lower energies used for the body than you may have been used to using previously, and this is because we are bulk heating the area and we're layering that heat in milliseconds. So we're not doing one pass, leaving time for some of that heat to come out and going back and doing the second pass. Within milliseconds, we're delivering lots of energy within that fractional zone. So we can afford to have lower energies but still have a really high bulk heating effect. You'll find as well it's lower energies than with the 24-pin tip that you may have done on the body, because also we have a denser treatment area. You know, we have a slightly bigger performance area, but we have 40 pins now. So each of those pins is generating heat. So it's a much denser treatment, creating additional concentrated thermal effect within that area. The aesthetic devices, if you have someone with quite deep soft tissue, then there is a good option of performing one pass at 5mm in the fixed mode and double pulsing, which is probably what a lot of you will have been familiar with already using the 24-pin tip. But then now we have the benefit that you could then go over that area again with a pass of 4mm and 2mm in the burst mode. So they get the advantage of a fixed double pulse deep in the tissue at 5mm, but then also a 4 and 2mm without having to do that 3 passes. So it's a really nice option for some of those deeper tissue areas. And obviously you need to assess each patient and each treatment area individually and judge the depth of the treatment and body area, the tissue and fat thickness on that individual area. If we're doing a knee, for example, it's highly unlikely that you're going to need to be going 5mm into that area, whereas on an abdomen or a thigh, it's much more likely. So assess the individual treatment area and set your parameters accordingly. These are some of your typical treatment parameters found on the QRG. So the abdomen, energies of around 20 to 35, and maybe 1 to 3 passes, as we've just discussed. Upper backs and thighs, similar, around 15 to 30, and again, around 1 to 3 passes. And lower thighs, where we're a little bit more sensitive, maybe around 10 to 25, and again, depending on the technique that you choose, 1 to 3 passes. The depths, as we said, will vary for the different depths of the treatment area. For subdermal treatment with a thickness of fat of less than 1 centimetre, you're going to use the 2 to 4mm as a maximum. For deeper treatments of deeper than 1 centimetre, then up to the 4 and 5 on the aesthetic devices and up to the 7mm for the body type. And you still have those options of cycle, fixed and burst. Burst is obviously a real advantage now, but as we mentioned, it may be that you want to do a deeper setting at 5mm on a fixed first and then change into burst. Typically, when you're using burst mode or stacking pulses, you're using around about a 20% lower energy setting. And as we said, this is because we are bulk heating the area. We're putting a lot of heat in within milliseconds of the treatment. So we don't have any chance for any of that energy to dissipate. And so we don't need to use a high energy to get the results that we require. And when you're selecting the burst mode, select the maximum depth on the screen. So for example, if you select 5mm, it will then fire at 5 and 3mm. This is your QRG. So we always obviously instruct you to follow the QRG body guidelines and the information on the QRG. So please do have a read through of these when we send them to you with the information. And this will be a guide as to your energies. As time goes on, as you have more experience, depending on the treatment, the patients that you're treating, you may find that you can increase those energies a little bit, but certainly as a start point, these are a good guideline for us. And then some of the benefits of the body burst treatment. So as we said, we've got an automatic multi-level pin depth. We've got sequential level penetration in millisecond intervals, and you get 3 shots of the levels with the body type or 2 shots of the different levels on the aesthetic devices. This is going to increase the treatment efficiency. It's going to give us faster treatments because we're doing reduced passes. It's also going to reduce the patient discomfort because, again, it's less needles and less passes and less time for them. And we're going to get that enhanced thermal coagulation effect because we're bulk heating that area, and we can double and triple bulk heat that. And that's the Morpheus body and the burst information. So thank you for listening. If you have any questions, then obviously please feel free to contact either your local representative or myself with any questions, and we can take you through things. And good luck, everyone. I hope it goes really well.